start with today's session on mandible and the associated few of the important instruments. So guys, like for the last time also, you can unmute and ask your doubt and any time, and even and it's always better that we make it an interactive session rather than a one-way traffic. Okay, because it will help ease boredom, and I'll just need 35 to 40 minutes of your topic, of your time. Okay, so just we'll try to finish few topics because jab tak result is not coming out, we all feel not that push for study now. So like just have some important topics for today, and similarly we'll keep on revising every day till 9 p.m. till your results are out. And once the results are out, automatically you'll start studying. Okay, so is my screen visible? Audio and video clear from your side? Can I have a thumbs up from anyone? Okay, so let's start with today's session on the mandible. The first instrument that we'll start with is the mandible. Okay, so let's see with this thing. Can someone take a try? What is this name of this deformity called as? Deformity. Yes, great. And the answer of this is Andy Gump deformity. I'll minimize it and I'll just write the answer. We will see the Osce also, which is asked from this section. Okay, this is called as Andy Gump deformity. This is an individual Osce in itself. And what is this Andy Gump deformity? This is mentioned over here. Okay, so coming to this topic of mandible. Over the mandible, you will have around 5 to 6 important questions that can be asked to you. The first thing will be mandibulectomy. Okay, so mandibulectomy can be of two types. जो पहला है that is marginal, and second one will be segmental. All these will be your viva questions as well as part of your Osce questions as well. So in marginal, what we do, we chalk out a small rim. That is, we take out a rim of mandible. So the advantage is, okay. So the first thing will be that this is the advantage is that the arch is maintained. The arch of mandible is maintained, because of which the stability is important. Of which the stability of the arch is maintained. So it provides better stability. Vis-a-vis what happens in segmental. Segmental mein there is resection. Oblique, full thickness you remove. So this will be your segmental section. So please remember both the names, marginal as well as segmental. Now coming to the classification. For classification, just remember two names. There are multiple, and you are most welcome to read about most of them, but please remember two of them. First is the Arkin classification, and second becomes your HCL Boyd classification. So these are the two classifications which we just talked about. First is the Arkin classification. This one, please read about it. This is important. You should remember it. And second is the HCL and Boyd classification. They can ask you directly also that name this classification, or they might give you the image also, and they'll ask you what is this classification and expand it. So both ways you have to remember. एक number का आएगा. ठीक है? So you should not forget this question. It's an important and full mark scorer. Coming to the next part, it's an important thing, reconstruction. So reconstruction is having 3-4 questions which are embedded in itself. So first thing which I would like to tell you is there's something called as THORP, THORP. Now can someone unmute and answer what is the full form of THORP? Try karo. Anyone? Chalo, I'll answer. I'll answer. The answer is titanium, hollow, osteo-integrated reconstruction plate. Please remember it. This is important. Guys, for your 20 OSCE questions, you will be getting 1 to 2 questions in which you will be asked to expand it. So Thor is a potential OSCE. Expand what is Thor. So please remember it. There is no embargo that you will forget it. Okay. So first important question is Thor. I'll show you the image also in the subsequent slide. Now the second important part is the fibula flap. This is an individual OSCE in itself. Okay, so let's see about it. Guys, these are the two images that can be asked from the fibula flap. You can be asked to identify the flap. You can be asked about uses of the flap, and they'll ask you what are the things that you will keep in mind while harvesting the flap. I'm enlarging the image. This can be one of the OSCE, or this is the traditional one. Okay, इस तरीके से भी they can ask you. Even they can give you that image of the calf showing the fibula section also, but that becomes very easy. Okay, so that's why it's not given. Okay, so the answer will be your free fibula flap. Uses, we all remember that it can be used in mandibular reconstruction, maxillary reconstruction, oral cavity reconstruction. And what we will keep in mind during harvesting, so we should keep in mind that distally around 6 centimeter of fibula should remain, because iski wajah se kya hoga, ankle stability is preserved. And proximally, you have to preserve one of the nerves. Can somebody try? Which nerve?
Common peroneal nerve?
Yes, Dr. Sahab, you are absolutely correct. So preservation of common peroneal nerve on the proximal side. So this is an important question for you guys. Please remember it. This will keep on coming. There will be few flaps which I'll tell you in the mandibular reconstruction. Few flaps will be there in the maxillary reconstruction, which we'll see in the next session. Okay, so please remember them. Now, third question which can come is this: what is distraction osteoneogenesis? This is from Cummings. Okay, this topic I couldn't find in Scott. This was there in Cummings. Please remember it. So, what is distraction osteoneogenesis? This is basically that technique of growing new bone. This is not pertaining exactly to ENT, more of the ortho question. But since in the mandibular reconstruction these things are given, so just have a look at it. You shouldn't be taken aback if this comes in your exam. Okay, so you should be at least ready to answer something. So I'll just write it. This is technique of growing new bone by stretching whatever the bone which you are having. You are stretching the pre-existing bone. Okay, so this is you have to remember, and there are few steps for it. What do we do? Initially, you are doing the osteotomy. You are removing the bone, the cuts you are making. Then there is something called as latency period. Yeah, any issue? Check. So latency, what happens? They might ask you what happens in the period of latency. There is formation of callus, all pertaining to ortho, nothing from ENT. Then there is period of distraction. What they can ask you, what is the growth rate? 1 mm per day. And then there is phase of consolidation. Then there is phase of consolidation. So these are the 4 phases that come. They might ask you what is distraction osteoneogenesis. Now the second question which can come from mandible is, what are the differences between adult and pediatric mandible? 1. Similar question can be asked: adult and pediatric larynx, adult and pediatric temporal bone. So like is tarike se keep on revising, keep on preparing your questions. So these are the differences which are given over here. Please remember it. This is from Dhingra only. Okay, so please remember this table. This is important. Okay, now for people who are there to learn everything, this is for them. That what are the muscles which are originating and inserted into the mandible. Generally, these questions are not asked to us, but you know, like I told you in the last time also, out of 20 OSCEs, 10 OSCEs you will be able to do it definitely. If you just recall what you have done in the last 3 years of your PG, you will do those 10 questions. For the next 5 questions, you need to read, you need to study for the remaining 1 to 2 months, push hard. And remaining 5 questions will be bouncer. आप कुछ भी कर लोगे, they will be bouncers. You might be knowing them, and it might be a case that they might just go over your head. You will be like, yeah, what is this image? I'm not able to recollect whether it is from otology, laryngeology, or analogy. This can also be the case. Okay, so we'll discuss these things in the coming slides. This is our second session together. So these type of questions can be like I'll say difficulty level questions, because generally we don't pay much attention to anatomy and all those type of questions. So if possible, please draw and practice once. This will help you in remembering. Now, what question comes from this image? Okay, what is the site where maximum fracture occurs in the mandible? Okay, so fractures of mandible के लिए please remember this picture. Fractures of. So what is the most common site that you can see? This is your condylar fracture. Okay, this can be one of the reason. Apart from that, nothing else is there from this. Now, this is the image of Thorpe, which I told you. They can ask you identify what is there. So you have to answer about Thorpe. These are the details given about Thorpe. Please go through it at your own time, and that should suffice from mandible. Okay, so people who are interested to read more and more about mandible, I will suggest to watch a video on YouTube by Dr. Virender Karian or Kardian, I'm not sure. Okay, so there is around 45 minutes to 1 hour video on mandible. I'll share the link. Okay, so that is basically about anatomy, all the hard bone, soft bone anatomy of mandible. So if you are interested in that traditional way of teaching कि ये anterior surface है, posterior surface है, from this foramen what is coming out, what all nerves are related, all those type of questions will be covered here. If you want to read, please go through it at your own time. Personally, I did not go through it. I felt boring in all those things. If you are interested, please go through it. Okay, so coming to second part of the class. Now, can somebody identify what is this instrument called as? Easy go. And let me tell you, this has been repeated at least 3 times. During my last 3 years of PG and 4 years past it, I've seen this coming for at least 3 times. मेरे भी PG में आया था, उसके बाद भी 3 times I've seen this question coming. Can somebody answer what is this?
Skeeter, sir?
Yes. So please bookmark it. This is a very important question. Skeeter. Okay, this is very important. Should not be forgotten at any cost. So there are few topics where you have to put more force as compared to other topics. Like in the otology section, whenever you are reading and revising, otosclerosis is a very important topic. Similarly, stapy surgery. Okay. All the things related to stapy surgery, whether these are instruments, your technique, complications, all these are possible questions asked multiple number of times. Second, I'll just enumerate the list. After otosclerosis, sudden sensory neural hearing loss, very important for you. Intratympanic injections. The image of this OSCE has been asked 2-3 number of times. Even in last Dnb session, also this question was there. Okay. Apart from this, third will be your superior semicircular canal dehiscence. Okay. Third window syndrome is very commonly asked in your viva. Please remember it. And then fourth will be your Meniere's disease. Okay, so whenever you are revising your otology, these 4-5 things should go like in a full thrust and revise the images accordingly. Okay, so let's move ahead. Okay. Now, can somebody identify this? Easy go. This was even shared day before yesterday in the group.
Yes, Colorado, sir.
Yes, this is Colorado microdissection needle. Okay, Colorado microdissection needle important because it coagulates and cuts at the same time. ठीक है, there is no fun in telling you the uses and all. वो आप सब कुछ Google करके you will remember it, I know. ठीक है, but please the images you should remember it. This is important. Not asked till now, but a potential question for you guys. Please remember it. Its uses in the ENT. It's important. Now. This is an actual question I think asked 2-3 sessions back in the main exam of DNB. Why is this important? Let me tell you. Please see over here. 4 minutes. Till the time you see all the images, you read all the 4 points. Believe me, यहाँ पे 2 minute हो चुका होगा. Now the panic starts. What to do? Okay. So please practice all these questions. The important things. The more you practice, the chances are that you'll make it correct better. And always attempt all the questions. What the problem generally people do is they are like they'll put lot of knowledge in one question. अभी यहाँ पे ये एक नंबर. Okay, example की बात कर रहा हूँ. I'm like just taking an example. So if you like put more information in any other question and you leave 2 questions, that is not a very advisable task to do. So attempt all questions, all parts. And there is no negative marks. So whatever you feel that this will be right, हो सकता है, even to the distant possibility, please answer it. Don't leave anything blank. Believe me, don't leave anything blank. Answer all questions, answer all parts. Most of the time you will be correct. ठीक है? So the answer for A is, I'll just write it. Want to take a try? Anybody? Let me enlarge it. A is perforator. Okay. B is Larkin's hand burr. Yes, bilkul. You are absolutely correct, sir. Larkin's hand burr. And C, we just saw that this is the laser. Okay. So what is the questions they are asking? A, B, C. Okay, you have got these marks. 2 marks आपके आगे. Name the surgical procedure where they are used. Okay, stapes surgery, you have got it correct. Now who will answer this? Mention the no contact tool for performing the above procedure. Anybody?
Laser, sir?
Yes. Which laser, doctor?
Argon diode laser?
CO2 laser. Okay.
CO2.
So please remember this point. This will keep coming in front of you multiple number of times. CO2 laser, when in the recent advances we'll be seeing the lasers. Again CO2 laser will come. And when we'll be seeing the scientist also, then again we'll be seeing this thing. So in CO2 laser, 2 things are there. The wavelength of CO2 laser is, can somebody again take a try?
10,600
nanometer. Absolutely correct. Please remember the units. Don't forget the unit. Okay. So my task in the coming 1.5 to 2 months are to sensitize you where you will make mistake. Okay. So please remember nanometer. Everybody will remember 10,600. फिर वहां पे एग्जाम प्रेशर में वो नैनोमीटर का माइक्रोमीटर हो जाएगा. So that creates problem. So please remember it. You're absolutely correct, sir. And this was invented by an Indian, C. Kumar N. Patel. C. Kumar N. Patel. Okay, he was a Guju bhai probably, and he invented this CO2 laser. I'll share the image also, and please remember it. So it's a question which can be asked from 2-3 ways from you guys. Okay, now again coming to a few of the instruments. Can somebody take a try? What is A? Let me enlarge it. Related to some animal.
Giraffe forceps?
Yes, absolutely correct. So the answer for A is giraffe forceps. Even the image might not be clear to you. Not an issue. ठीक है? Not an issue. After the class, Google करके giraffe forceps अलग से देखता है. ठीक है? The purpose of putting this image is that you should get sensitized. These are the images that we will be doing over the next 1.5 to 2 months. These are as it is asked in the OSCE. I think last to last session का image है ये. Okay, so the uses of giraffe forceps are it's used in the frontal sinus to have access to frontal sinus in multiple polypectomy, removal of foreign balls, all those things. You can answer it. Now, the second one is the easy go. What is it?
Carisons.
bone punch. Okay, so this was the easy one. B. Garrison bone punch. Uses we all remember. It's used in sphenectomy. It's used in DCR surgeries for your taking out the bone. Now, normally what happens in all these OSCEs, they'll give you one question that is lengthy, and remaining question will be pat, small. Like see in this question, if you remember, know what are these, you'll get khadak se 30 seconds, 30 seconds, 30 seconds. Now the problem comes over here. So again, one of the very important topics, whenever you have time, guys, please make a list and assemble all those things. This is one of the very important thing, the draft surgeries. All, not only one. They will ask something or the other. They will ask you something or the other. Apart from draft, from this section, please remember the boundaries of frontal recess. Okay? Till the next 8 months, I'll keep on telling you, guys, rhinology may revise this. In otology, you have something called as sinus tympani, frontal recess, Prozac space. One of them will come in your exam. Will come somehow or the other. Even they might ask you classification of sinus tympani. They might ask you CT scan. They might ask you shape. Something from the frontal recess. Something from the Prozac space. CT scan, cholestotoma. It will come. Similarly, from here, draft, frontal recess and AFRS. Mind my words, one question definitely will come from this thing somehow or the other. So please remember all the draft things. So here they have asked, क्या पूछा है? Draft 3 पूछा है. So draft 3 में, please remember it's not very difficult. Okay. Once you go section wise 1, 2 and 3, so it's better understood. But for answering over here, anteriorly you go for the anterior frontal table or the frontal beak. The posterior limit is first olfactory neuron. And the lateral limit is lamina papracia. Okay? So please remember it. Instruments will change. It's not that ki giraffe is gonna come or not. Something else will be there. Whatever you are using, you'll write it. Not to worry. But the remaining question should not go wrong. Okay? What is there? Okay. Can somebody identify what it is? Torch mat bolna. Torch nahi hai. Something from larynx. Larynx. Torch nahi hai.
Electrolarynx.
Yes, it's electrolarynx. Okay? It's electrolarynx. So here, please remember details about TEP. I'll be sharing all these things with you in the PDF. I'm sensitizing you. These things are for sensitizing कि ये पढ़ना है, वापस से पढ़ना है. Primary, secondary TEP. All the rehab after total laryngectomy. Okay? All the rehabilitation after total laryngectomy, especially your voice rehab. This is very important. Okay? So all the type of esophageal speech, electrolarynx, it's important. So please go through it. This question will come to you. Okay? Now, one more. Now, this is something related to your thyroid. One more hint to you.
RLN monitor.
Yes, doctor. Okay? So these are the things. So इसमें they can also give you, there's something, they might ask you, identify what are the uses. Definitely you will answer it. What nerves are used to monitor? That you will answer RLN and
EBS.
Okay, so these are the questions that can come. Apart from that, there are specific RLN ET tube, in which around the ET tube they are having few red and blue wires. After the class, I'll share the image with you. You'll have red and blue wires over there. So remember that tube also, ET tube. It is related to your RLN monitoring. Specifically, if they ask you where do you use it, so you use in the surgeries requiring RLN monitoring. Okay, so RLN monitoring. Ab iske baad, there are few things that you have to do. First is there's a single PDF which I had sent you around 10-15 pages. that is all the basic instruments. Okay, basic instruments मतलब उसमें Jobson horn and headlight, tonsillectomy, all those things are given. Please go through it at your own sweet time. ठीक है, there's no fun in telling. It's like you should know about it. Second, and the important thing will be powered instrument in ENT. So here, radio frequency, coablation, cautery, all those things, hydrodissection, all those things I've covered. Okay, so this I will be sharing you a PDF. This is approximately 6 to 8 pages. Please remember it. Third will be your stapes surgery instruments. Fourth, cochlear implant instrument. CL endoscopy instrument. Okay. So these are the mota things which you have to remember. This I have shared with you till now. So today I'll share powered instruments with you. Please go through it today and tomorrow. I think 2 दिन में 6 page you can easily cover it. Please read it. Okay. So tomorrow I will share these 2 things. Okay. So that you make a like separate sections for yourself for a PDF for instruments. This will help you in the OSCEs and also in the table viva. Generally what they do in table viva, they have one table for instrument and one table for CT oblique radio. There is radiography table. Depending upon if sections are available, they might have hard bones and soft tissue specimen. What are soft tissue specimen? जैसा anatomy pathology lab में you would have seen कि lungs को उसमें formalin में भर के they have kept in a big jar. So similarly they have certain specimens for us. Like example, total laryngectomy का specimen they'll keep it. They'll keep some maxillectomy specimen, and they'll ask you to describe it. All these things depends upon whether what all things are available over there or not. Okay, CT में generally there are few important CT scans. I'll share it with you what all to go about. Okay, so this is how the table viva will generally go about. This is a general scheme. It might differ from one center or other depending upon the patients or specimens available over there. So this is the generalized scheme. Okay, so these are the things over here, and it's not that इसमें ही all the instruments get covered. No, this will provide you a broad spectrum of instruments. There will be few things which will be coming around. You'll read something, you'll find something new. Please add to your list. It's not that this is entire इसी में से आएगा. No, this will help you out. But whatever anything new which you will get, please add on to it. That will help. Whatever anything new which I'll get, I'll keep on posting to you at the group also. Okay, so this was a short discussion for today. Please remember mandible. This will help you out in the session of. This will help me in the session on the remaining session on osteology. Then I'll put more focus on maxilla and base of skull. So those are also very important section which will give you 1 to 2 questions at the main center. Okay, so I'll rest over here. Anything from me, please let me know. Any point from your side? Okay, I like totally accept that till your results are out, you all will be in a dormant mode. I totally agree. But keep on reading, and anything for me, please drop me a message. We'll take care of that. Whatever things you want to include in your schedules. Okay, so see you on the next class. Tomorrow I'll share all the instruments. Powered instrument I'll just share in the group. Please have a look. Okay, chalo, bye. Take care. Good night.